Good evening, doctor.
Good evening.
It is important to discuss about corona in the present situation because we notice that the world is panic situation.
Yes, you are absolutely correct. Now the situation is abnormal. Everyone is panic. So it is necessary to discuss about the issues regarding coronavirus. You can ask your doubt. We will go to the discussion.
Number of deaths in the world more than corona is the past 2 months. Common cold, malaria, HIV, cancer are. Why people worried about corona?
Yes, of course. If you see the diseases, death cases, whatever you say, like cancer, it is the cause, genetic or due to lifestyle. In the case of malaria, you know how to control because the vector mosquito is the reason for the malaria. Similarly, in the case of AIDS, HIV, it is a sexual transmitted disease, and you know the reasons, blood transfusions, like that. And in the case of common cold, this is a airborne disease. Of course, there are different kind of influenza, influenza A, influenza B. Influenza A and B not that harm. The self-immune system can defend the disease. In the case of influenza C, that what we know by name swine flu from pig, bird flu from birds, and Ebola again from the bats, and we say monkey flu. So there are different kind of influenza. We know the origin, bird, monkey, like that. We know the origin, so we can take necessary precautionary measures. But in this case, in the case of corona, we don't know the origin, no idea. So this is the problem. Yes.
Why corona treatment is difficult?
Of course, if you take the viral diseases, there are no specific drugs. Okay, we have antiviral agents to manage the disease, but we cannot cure. Okay, the self-immune system is so important in the case of viral diseases. And already I mentioned we don't know the origin in the case of particularly corona, but other cases we knew. That's why the World Health Organization declared the corona is pandemic infection. So that is the reason. So and the main, the fundamental issue, viral diseases are different, and bacterial infections are different. Bacteria is completely different. It owns cell with all the machineries, but virus do not have any machineries and don't have own cell. It is just a RNA, a part of the cell. Okay, so the part of the cell use our cells for its replication, for multiplication of so many virus. So this is the reason it's very difficult to corner the virus, or difficult to treat the virus, whatever. Okay. Yes, please.
What kind of preventive measures to be taken against corona?
Yes, of course, prevention is different, cure, the word cure is different, treatment is different, management is different. So, first of all, to improve the immune system, you should have a balanced diet. But immunity need a rich protein food, and balanced diet means it included with vitamins, minerals, antioxidants, and the regular exercise. If you are active, your immune system also active. Okay, and the sleep. Especially between the sunset and sunrise, at least 6 to 7 hours sleep is very important. And of course, in all the media, you might have noticed from everyone, the personal hygiene and community hygiene is so important. If you maintain your personal hygiene and someone your community is not following their personal hygiene. So that's what we say, the community hygiene. Then if community hygiene failure, then the infection spread very fast. Yes.
Face mask is beneficial or not?
Yeah, so it is coming under the personal hygiene and community hygiene. Yes, of course, it is very important because the surgical mask can prevent you from the airborne disease. That means from the droplets coming out from the infected person. So both should wear the mask, at least the surgical mask, because the disease is spread by in the airborne disease, as well as contagious by touch. You can say the physical contact. Yeah. So to be avoided, isolation is very important. Yes.
Some health profession advise to take lemon, garlic suggestion.
Okay, lemon, of course, it contains vitamin C, but the problem, people are taking lemon juice in the empty stomach in the morning. They say, I am going to improve my individual immunity. But you know, you are looking the ascorbic acid, the vitamin C in a lemon, which is very small quantity. Okay, but there are so many things in the lemon called citric acid, lemonine, lemonal, volatile oil in the lemon. So when you take in the empty stomach, this other chemical constituents other than the citric acid, ascorbic acid, may cause some side effects. So better to take the lemon, fresh lemon, okay, with the salad, with your food. So it will not be harmful to your gastrointestinal tract. And of course, garlic, we habituated from the childhood. So whatever we take from the childhood in our day-to-day food, with the food as an additive, it is not a food, it is an additive. Okay, so we don't consider those items as a main drug. Okay. Yes.
Why certain countries are affected more by the coronavirus?
Yes, good question. Certain countries, yeah, I would like to show the to you your world map. See here, look at the world map. This is China, okay, and China, you have in the center of the China you have Wuhan, okay. So if you look to the east, if you look on the east, there is South Korea, and in between South Korea and China, Hong Kong, and Japan next. Okay, and if you come towards the west, okay, in the same belt, okay, you will see Iran, and after Iran you can see Italy. Okay, so I can say this is called corona belt, understand. So you can ask, there are some other countries also in the corona belt, okay, but the earth rotate in a particular axis, okay. It's a little and there is axis, there is angle, okay. So that's why the geographical locations will be little bit different, and the weather is little bit different, but it is in the same belt, okay. So that's why I believe this region is affected because of the weather conditions and the geographical conditions. Okay. Yes, please.
Coronavirus infection related with weather conditions or no?
Of course, weather condition is one of the important point, but we cannot completely agree with this point, because last infection, what we call the MERS, Middle East Respiratory Syndrome, we were affected by this disease on May. Okay, so might be in summer also, because the virus do themselves a mutation. So due to the mutation, some of the virus can survive in the extreme weather also. So we can't say summer, winter like that. But when you see the past history, most of the infection spread in the time of winter, like February, March, January. You see SARS, okay, and actually the coronavirus they discovered in 1969-70, but usually the coronavirus attack only the animals. We came to know the coronavirus spread to human being also from 2002 when we faced SARS. Okay, so the virus keep on changing the genetic code or it functions, so that very difficult to um, very difficult to treat the viral diseases. Difficult, yes.
So next, is there are any link between China, Italy, Iran, South Korea, Japan, Singapore regarding the corona?
Yes, of course. If you see, take Italy, the European network, you see the network train railway network. Most of the train start from France, Germany, and end with Italy. Okay, so there is a tourism. At the end point is Italy. So and Italy is very dense populated. China also dense populated. Of course, Europe population is less, but density will be there. Population density is there in the Europe. In the case of Hong Kong, South Korea, China, this is air route that side from China, center China to yeah, or any part of the China, then Hong Kong, then Japan. There will be mass migration nowadays. Mass migration in the past 2013 when we have swine flu or when we face MERS, Middle East respiratory disease, we don't have this much mass migration in the world nowadays. Because of the economy, business, people are moving, tourism developed a lot. So this is one of the important factor for the disease spread.
Mode of spread of the infection.
Mode of spread, we already discussed contagious physical contact, as well as the by airborne, because of sneezing spread through the air. Okay, that's why we insist personal hygiene and community hygiene. Yes.
Is it a dangerous to the health professional?
Of course, the health professional are very near and have direct contact with the patients. The health professional should use PPE, the expansion personal protective equipments like shoe cover, gloves, mask, especially N95 mask, okay, which filter the particulate matter, because the virus average size 125 100 to 125 nanometers. It is equal to zero point 0.1 micron to 0.125 micron. It is you can say 50 times or 100 times less than the bacteria size. Okay, so better to use N95 mask, especially who is involved in the direct contact with the patient, health professionals, the face barriers. Okay, so these are the gown, disposable gown. These are very important to them. I don't want to mention the victim names, but we saw so many victim in the health profession in the past 2 months. Okay, yes.
Is there any vaccines? What is the importance of vaccine?
Vaccine is very important uh, because it provide acute immunity, not a natural immunity, acquired immunity against the diseases. But unfortunately, we don't have vaccine for viral diseases. We have vaccines for influenza, common cold, even triple vaccines are there. But it is very important vaccines in the case of viral disease. Yes. Okay. Uh, so what I like to say, for example, you bring a person from the from yeah, island, Amazon forest, or the what we say Senegal island. There is an island near to Andaman Nicobar. Okay, those people don't have contact with the world. Okay, they don't have vaccinations. They never had vaccination because they don't have contact with the world. If you bring tribes from there to our land, he cannot survive even 1 month because he never had vaccines, so he don't have immunity for our the virus and the bacteria. So definitely he cannot survive. Okay, so vaccination is very important, but we don't have so far any vaccine for this particularly corona.
What about the treatment?
Sorry.
What about the treatment of corona?
Treatment, we have antiviral drugs. We can manage the disease by isolation and with antiviral drugs, and also one of the anti-malarial called chloroquine phosphate. And we have a combination protocol. Almost globally, they are using the combination of antiviral agent, but we are not sure that this particular antiviral combination will be successful against coronavirus. We don't have an idea because there is no drug so far, specific drug to cure the disease. This is all management and treatment. Okay, I already mentioned management is different, cure is different, and prevention is different. Yes.
Is there any chance from coronavirus to face the disaster of mankind?
Yes, of course. Once again, what do you ask?
If there any chance for coronavirus
Yeah.
to case the disaster to mankind?
Yes. Yeah. The you see the evaluation of evaluation of human being. Okay, it starts from single cell. Protozoa, Porifera, Nitariata, Coelenterata, Ascalminthus, Flatculminthus, Annelida, Arthropoda, like that. Then fish, birds, like that. The evaluation takes place. Okay, the lower level organism, like microorganism, never eradicate or kill the complete population of human being. Not possible. Okay, because the higher level is holding everything, the lower level cannot do anything with the higher level. Okay, but there is something called man-made microorganism. Okay, biological weapon. Okay, but biological weapon can completely destroy the mankind because of the mutation made by the man and by the quantity spread to the mankind. Okay, so yeah.
What is the source of coronavirus?
Source of coronavirus of course, what is the source of molecule? Atom is the source of molecule. What is the source of the atom? Neutron, proton, electron inside the atom. Okay, this is the basic fundamental unit of the matter. Okay, similarly, in the case of organism, the basic matter is cell. Okay, so cell is the source. It is a single cell organism. So inside the cell, what is there? There is mitochondria, um, RNA, DNA, membrane. Like it is one part, a part of the cell. The part of the cell, RNA, it is the source. So this source, RNA, everywhere available in the form of virus with coating, glycopeptide coating. But we don't know this organism is dead or live. Okay, people are still discussing, scientists are discussing the organism is dead, the virus are dead or living matter. Okay, because this RNA, just RNA with the protein cover, may get life in a suitable environment. So that's why I felt this particular geographical location, Corona belt, okay, is suffering too much from the disease. Yes.
A person get negative result towards corona can be positive.
Yeah. When a person get negative results, the virus enter inside the uh, human cell. Okay, it is inside the cell. It is using the human cell machineries. Okay, virus don't have any machinery. Virus is just a DNA. The human cell cannot, the human immune system, defense system cannot recognize the virus. Okay, so at this time, if you do test, it will be negative. Okay, because the virus still not release the toxins out, the endotoxins. The endotoxin only show whether you have viral disease or not. But at one stage, the virus started replication, and number of virus coming out from the cell and targeting other cell. At that time, you will find the endotoxin, then you will get positive result. So before you say that incubation period, in the starting time of the incubation period, you can't recognize the person is deceased or not. So you will get negative results only.
Why the mortality is more in the case of chronic disease patients and children?
Yes, of course, the aged people have less immunity to compare the active youngsters. Children also, say 1 year, 2 year, 3 year. In this 3 year, this kid is not exposed to so many microorganisms. When you expose to more microorganisms, then you will be having more immunity in the body. Okay, so because of the immunodeficiency, the virus target youngsters, no, not youngsters, children and the aged people who already have infection, already have disease, chronic diseases. Their immunity will be low. For example, diabetic or bronchitis. Yes.
Okay. What is your opinion for regarding coronavirus population?
I already mentioned population doesn't matter. For example, say America, Canada, Australia, they have a huge land, okay, and density of population is less. But you see Europe, China, India, thick population, density. So density populated area will be more affected than the less dense population area. So if you see Italy, Hong Kong, Singapore, these are all highly dense populated area. So that is the reason they are suffering. Not only the corona belt, what I said, that geographical condition, as well as dense area, which have mass migration due to tourism or the air route in between the in the air route. Okay, for example, Singapore is in between China and other area. Hong Kong is in between China and other important world destinations. Yeah.
Okay, one more last question. Do you believe the virus will be end in the summer?
Yes, we already discussed few points about this. I already mentioned about the Middle East respiratory disease, okay, in April, May. The problem, you have South Hemisphere and the North Hemisphere in the world, okay. America, Canada, India, China, Hong Kong, South Korea, Japan, these are all, Iran, Italy, in the north hemisphere. North hemisphere, particularly corona belt is affected now. Okay, after some time, the north hemisphere get summer and the south hemisphere get winter. Okay, for example, South Africa, New Zealand, Australia, Argentina, these are all coming under South Hemisphere. So if the disease is influenced in the case of winter, so again there will be a winter in other part of the world. So it is something difficult to answer. Yes.
Okay, thank you so much for
Thank you so much
informations.
for the opportunity given to discuss corona, because it is very important. Thank you so much.